So good morning again. I was given a task to prepare some summaries on to introduce AMR surveillance in Tanzania. But I would like to take you back when the issue of AMR started globally. So this was in May 2015 in the 68th World Health Assembly, which adopted the Global Action Plan on Antimicrobial Resistance. So this was happened because they found they have a lot of issues related to antimicrobial resistance. And based on this Global Action Plan, they wanted countries to adopt the plan. And these actions which was required from countries was in several areas. One was to reduce antimicrobial usage through improved water and sanitation and immunization. And then the issue related to hospital infection, to improve hospital infection and antimicrobial antibiotic stewardship. And then to change the behavior of incentives that encourage antibiotic overuse, then to reduce the eventual phase out of antibiotic use in agriculture, and then to educate and inform health professionals and policymakers and the public on sustainable antibiotic use. And one of the other action was to invest on antimicrobial resistance surveillance and the research. So based on these actions, which was wanted to be taken globally, in Tanzania, so the country prepared and then created a national action plan from 2017 to 2020. This national action plan has 5 objectives. And one of the objectives is to strengthening the knowledge and the evidence based through surveillance and the research. So in a national action plan on mechanisms, the country created some technical working group and an MCC, and the 4 technical working group were established. One of the main technical working group was antimicrobial resistance knowledge, surveillance, research, and the sustainable investment. This technical working group had a mandate to coordinate activities related to surveillance. So starting from there, we created the National Antimicrobial Resistance Surveillance Framework with a one health approach. So the purpose of this framework was to have a guide on how to conduct routine AST on pathogens, and to establish monthly reporting of antimicrobial susceptibility test results, then to establish regular and systematic communication of antimicrobial susceptibility testing results from a testing laboratory to a clinical providers, infection prevention teams, and the stewardship team. Then the other objective was to analyze, interpret, and publicly report the annual AMR surveillance data in a written report at each surveillance site, and then to participate in a global AMR surveillance through reporting to GRAS. So this national action plan is this national antimicrobial resistance surveillance framework created a guide, I've already said, and then partners came to support implementation of this framework. So the implementation currently is conducted by 2 projects. We will get more information related to this, and the sites which are involved in animal health and the human health will be presented with the subsequent sessions. So the purpose of the national AMR surveillance is to connect 3 areas. One, the hospital or the sites which are involved, whether it's animal health or human health, whereby the data will be generated. And then the aim is to, if it's in a hospital, is to improve patient care and the diagnostic stewardship, and then to target interventions in the antibiotic stewardship and the antibiogram development. So the data which is generated in the surveillance sites and output are supposed to be shared nationwide. So this data should go to the national level. At the national level, we have a national AMR unit. And for our plan, we will see later how this unit is coordinated. And the data which is generated here includes the data which is obtained at the reference laboratory. So we have a reference laboratory system, and from here we can now have an output sharing the data with on the development of policies, and then reporting surveillances which are required in some parts. Then sharing this data globally. So in nutshell, that's how our national surveillance framework aim to do. So they in short, the AMR surveillance in country that's how it came out. That's how it was developed, and that's how it ended. More information will come when I will present on the justification for conducting surveillance in country. Thank you. I think that's the end of my presentation.
Okay, thank you very much, Dr. Majungu. I think now you can proceed with the justification for AMR surveillance.
Okay.
Yes.
Can you see the slides?
Yes, it's opening.
You will tell me if it's okay.
Yes, Dr. Majungu. Very clear.
Okay. So maybe let me a little bit take you through the antimicrobial resistance. You know, antimicrobial resistance is an issue. You see, the most important if you consider the most important problems associated with infectious disease today, you will realize that it's mostly caused by the rapid development of antimicrobial resistance. And I've already said WHO has declared antimicrobial resistance as a public health threat. And with the situation we see, if we don't act, will force us to change the way we view diseases now and the way we treat patients. However, we have noted the rapid development of resistance to the antibiotics which have been developed and started from in 1940 when penicillin, before penicillin introduced, and actually we found penicillin resistance immediately after 2 years. So, and then development of resistance continue with, we saw the introduction of vancomycin and then resistance of Staphylococcus aureus on methicillin. And then whenever the drug is introduced, we see development of resistance. So it's an issue. So the pace of developing drugs are not equal to the pace of the resistance of the drugs. And you see that if you compare the death attributable to AMR every year, it's a lot. Currently, you might, compared to other diseases, currently you might think it's very little, but if you project the deaths into caused by AMR to 2050, it will be more than 10 million compared to other diseases. And this will be reading compared to other diseases like tetanus, cancer, cholera, diabetes, diarrhea, and measles, and the road traffic. We project antimicrobial resistance causing many deaths than other conditions. And we have noted that antibiotic resistance threaten the return of us to the pre-antibiotic era. Even in Tanzania, the antibiotic resistance decreased the rate, the reduction from 70 to 20, so about 50% change. And so the problem is massive, even in Europe, whereby the patient die from multi-drug resistance bacteria annually. And this multi-drug resistance actually increase. So before AMR surveillance in Tanzania, there are some issues, some challenges we noted. There was a lack of unified guidelines which pertain to antimicrobial agent consumption, testing, and data management. There was a lack of national AMR surveillance in a context of One Health approach. There was inadequate laboratory resource with the equipment and the reagent for AMR detection services. And then there was a lack of clear plan to sustain AMR activities. So based on this, actually there was a need to develop a system to monitor antimicrobial resistance, and which is AMR surveillance. So there was a requirement to address the challenges which I've already presented, and this includes establishing a national AMR surveillance system, building a laboratory capacity for AMR surveillance, then establishing and supporting coordinated mechanism for AMR activities, and then investing to sustain intervention on the AMR. So this requirement, as you can see, we have already worked on some of them, which includes establishing a national system for antimicrobial resistance, and whereby it needs a setup of a national multi-sectoral technical working group on AMR surveillance, which we have already created, develop a national AMR surveillance protocol. The protocol will be found in the AMR surveillance framework, and then to develop AMR surveillance reporting system. Now, currently the sites which are implementing AMR surveillance are reporting to the National Reference Lab, as we will see from other presentations. And then establish antimicrobial agent consumption surveillance in human, animal, plant, and the environment. We have started on establishing the consumption in some facilities, and actually this will go hand in hand with antibiotic stewardship. So the other areas which was done is to build a laboratory capacity, because having a surveillance system to be well functioning, you need to build a capacity of the lab. So this included to designate a national reference laboratory for AMR surveillance, and then to build capacities for selected zonal and the regional laboratory for AMR surveillance. We will hear from other presentations, the sites which are involved, and then the support which have been provided from the feedback which we will get from the partners who are engaged in AMR surveillance. And then establish laboratory data management and the reporting system for routine reporting of AMR. And I think the sites use WHONET for this purpose. And then to strengthening supply chain system to support laboratory on AMR surveillance. And then to strengthen quality assurance system for AMR surveillance. And most of these activities are coordinated by the National Reference Lab. So I think based on what AMR surveillance in country, in order to combat the problem is required in a global action plan. Thank you.
Thank you very much, Dr. Mavugo, for your comprehensive and a very understandable sort of presentation. Yes, now I think we can proceed with the request for Madam Siana. Please, can we get a quick presentation from Madam Svel before we proceed to Professor Sen?